Hi everybody, Ziv Simon here. I'm the creator of Surgical Master. Thank you so much for attending the broadcast on the step-by-step surgical protocols. It was a long broadcast, 8 hours, but there were thousands of doctors online learning, excelling, furthering their knowledge when it comes to surgery. Now I have a lot of doctors asking me about suturing, and suturing is such a critical skill in surgery that you can do a surgery real well and follow all the steps in the protocol, but you can mess it up with the suturing if it's not done properly. And the purpose of this video is to give you some tips and tricks when it comes to suturing in the aesthetic zone. So if your suturing is not where it should be, is not up to par, and you need a little bit more guidance and knowledge, definitely invest your time and energy in learning how to suture. In this video, I'm going to show you how we handle suturing in the aesthetic zone. In the first case, I'm going to show you how I suture a soft tissue graft in the aesthetic zone. So this patient had a tooth that was non-restorable. It was hopeless. The soft tissue covered. I extracted it and was planning to graft it with bone, but also graft with a connective tissue graft so I can enhance the emergence profile and get a better aesthetic outcomes. So the first thing that I did after the extraction, I harvested a connective tissue graft from the patient's palate, and I tunneled the buccal and I inserted it under the buccal tissue, and then added a bone graft, condensed it into the socket, and tunneled the palatal tissue to allow the graft to be placed under the palatal tissue. So the question is, now that I have a bone graft in the socket and I have a connective tissue covering it and enhancing the buccal tissue as well, how do I suture it? So my advice to you is look at it like a compartment technique, where we typically place a collagen plug or a PRF plug or even gel foam on top of the bone graft material, and I would consider the connective tissue graft as if it is a PRF plug or a collagen plug. So because I reflected a small buccal flap and a small palatal flap, the first thing that I did was to place two interrupted sutures that approximate the papilla, one on the distal and one on the mesial, just so we can get some alignment, because this is the first step of suturing. You need to align your flaps so you have good closure and good approximation of tissues. The next step, in order to hold the connective tissue graft in place, similar to the compartment technique, I'm going to place an X suture, and I'm going to start with the distobuccal line angle, exit through the distopalatal, then go over the connective tissue graft and enter through the mesiobuccal and exit through the mesiopalatal. And when I tie a knot, I will get the X pattern. Now, when we have a connective tissue graft, we have a couple of ways to suture it. We can suture it directly, but it was important for me to hold the buccal connective tissue in place, so I placed another X suture to stabilize the graft. You could alternatively also engage the connective tissue with a horizontal mattress and suture it in an apical direction like I showed you during this broadcast. And when you utilize this type of suturing, your graft is going to be stable. You can expect great healing after this procedure. Now, when it comes to larger areas that you are grafting and performing a guided bone regeneration procedure, it's critical for you to have primary closure. And a lot of dentists are struggling with primary closure because, number one, they're struggling with the suturing aspect, but you can suture very well. If you did not release the flap and it's sutured completely passive, you'll have retraction of the flap, and obviously the bone graft itself will be compromised. So how do we obtain primary closure? In this case, I placed an implant, and there was enough bone to place an implant and stabilize it, but there was a deficiency on the buccal, and I wanted to graft additional bone to improve the emergence profile and have just more volume of bone around the implant. So I used a collagen membrane on the buccal, and I'm planning to add some bone graft material. Now, the key to closure, because you're adding bone volume, the current soft tissues will not allow to close it without release. So what you need to do is grab the flap with cotton pliers, use a fresh blade, and release the periosteum starting where the full thickness flap ended. So that means that you're transitioning from a full thickness flap to a split thickness flap, because the mobility of the tissue comes from the mucosal part. So if you're splitting the periosteum, if you're leaving the periosteum attached, you are sliding the mucosa in a coronal direction. That will allow you to cover the additional amount of bone and the membrane so you can have primary closure. So what is the key of suturing in this case is flap alignment. You always need to align the flaps to allow you to gain the maximum closure and primary tension healing. So what I did here, I aligned it with two simple interrupted sutures and maybe a third one as well, but also with a horizontal mattress suture, which is also important in creating flap stability. It's a type of suture that creates good closure and very stable healing pattern. And a week later, you can see that the flap is not opened up. There's very little inflammation around those Prolene 6-0 sutures. The patient is healing well and did really well when the time came to uncover the implant. So I hope this video was very helpful to you in terms of understanding some principles of suturing in the aesthetic zone. The key to suturing, number one, is to align the flaps, create some flap stability, even by using simple interrupted sutures initially for the alignment, and then adding additional sutures depending on the procedure. If it's a socket graft or a compartment technique, you can add the X suture that will apply coronal pressure. And if it's a procedure that involves guided bone regeneration, you want to have tight and stable closure that will help with the healing. I hope this video was helpful to you in giving you some more information about suturing and some tips in regards to suturing extraction socket and GBR. I hope you enjoyed these protocols, and in the next part of this video I wanted to share with you your success protocol. What are the things that I recommend you do to be successful in surgery? In this training we went over 21 protocols. Okay, I guess I was pretty tired when I made this slide, but it's really all of it is in here. All the protocols, all the systems, the course itself today. Michael, thank you so much for being with us for the past 7.5 hours, for recording it in HD. You may be watching this on the broadcast page. We reduced the quality a little bit so we have a better streaming ability. But this course, all our interaction, all the questions, the slides, the teachings, everything was recorded in HD. And it's going to be edited, and we're going to create a course that is going to be called Protocols and Systems. Part of it is online, part of it is our companion, the protocols. So the question is, after 7.5 hours, are you ready for surgery for a great 2018? Are you surgery ready? That's what I want for you. So the last protocol, and this is the bonus, okay? This is the bonus that I talked about in the past, for the whole day, actually. I want to share with you what I believe is the protocol for your success, the system for your success. We already agreed. You're watching this broadcast for the past 7.5 hours. You know that protocols and step-by-step protocols and systems are important. You all saw what following a proven methodology can do for you. And we already gave this away for free. For everybody that watched on social media, you already have some tools to move on to the next level. In crown lengthening, in aesthetic and functional crown lengthening, is the #1 skill a doctor needs to have. It has everything in it. So part of aesthetic and functional crown lengthening, hands down, it's the most important procedure. That's why crown lengthening was the first procedure, or really the one that you and I decided change things around over the world, because if you're not performing surgery, it's an entry procedure to the surgical world. If you're already doing surgery, your bone recontouring, and then you're going to do. Are you going to do this? A complete surgeon. So that's well-rounded, absolutely, and that's really, being well-rounded.
understand the systems and protocols. You need to be able to do practice implant dentistry. It's really here to stay. And if you're not placing implants as a general dentist or even as a specialist, not every specialist places implants, you are not addressing what your patients need. Now, I know it's hard, so I recommend you have a proven methodology of placing implants, but not just staying where you are. Always finding ways to grow and getting to the next level. So you need to have some training and some knowledge and an ability to grow from doing simple cases all the way to the big advanced cases. Lastly, in order to be successful in 2018, and that's part of my recipe for your success, my protocol, so follow it to the T. Okay, it's not in this book, okay? It's right now, live, verbal. I'm talking to you like a friend, like a mentor and a coach that spent a long time now to share these protocols with you. You don't have to do this alone. You don't have to do this alone. You need the support. You need to be surrounded by positive people, by energetic people, by non-dogmatic, non-judgmental dentists. And you know what? That's the surgical master community. Okay, so if you want to learn the systems, the step-by-step protocols, if you want to learn crown lengthening and excel in aesthetics and excel in restorative dentistry, if you want to learn the basics of implantology and implement implantology principles in your practice, how do you create an inventory, and how do you negotiate with your implant rep, and what are the important things with implants. And really, if you want to take your skills to the next level and want to do it all under support, then I offer you the aesthetic and functional crown lengthening surgery to make your surgery ready in 2018. And I'm going to be offering this program with a few bonuses that address crown lengthening, implantology, getting to the next level. And I'm going to be including, for doctors who join, I'm going to be including the companion, the protocols book, and the recordings of this day. And that's my offer to you. That's my protocol for your success to get you surgery ready. And I wanted to show you how we're going to do it, how this works. What is the course on aesthetic and functional crown lengthening? How does it work? How do you participate if you're now watching this from Dubai or from Europe or from South America, Africa, anywhere that you are in the world? How can you learn surgery in an online form? So this is how it works. So the program itself is global. You don't have to come to Beverly Hills. You don't have to come to the United States. You don't have to spend the time, the money, and the energy to travel. You can learn at your own pace and at any skill level. You can be intermediate or advanced. And the program itself is a 4-week training on a dedicated platform where you're going to be learning the principles of aesthetic and functional crown lengthening so you can implement them. What's the point in learning something if you're not going to be doing it? So this program is meant for doctors like you, like Rashad, like myself, that are busy. We can't always take time off and travel. We want to learn, we want to excel, but you can do it at your own convenience and at every skill level. So this program is 4 weeks. In week number 1, we're going to talk about, I'm going to teach you the tools and the incisions, the flaps, the surgical principles that you must know so you can be prepared to diagnose the patient and be prepared to do the surgery. In week number 2, I'm going to talk to you about when is crown lengthening indicated, so you can recommend this procedure to the right patient. Don't get the diagnosis wrong and do the right procedure on the wrong patient. We don't want that. In week number 3, I'm going to show you how to prepare yourself and your teams so you can be successful, so you don't have to doubt yourself and have like, I'm not sure, I'm not confident. Why? Because I want you to be prepared. So this is going to be a successful experience for you. And week number 4, I'm going to show you the exact step-by-step method of how to perform crown lengthening. Very much in detail. We already started today. I already gave you 2 protocols, but there's so many little and big nuances and differences between patients. So we're going to drill into how we actually do this procedure. So in week number 1, I'm going to teach you what you need to know about surgery. What are the right tools and instruments so you can learn how to plan your flaps and how to create incisions and what's exactly in the surgical kit. So when you look at it, you're not confused, and there's a lot of the instruments that you don't know what they are. Okay, and I'm going to direct you and tell you this is the instrument you need to use for this step in this protocol. Very, very actionable and very, very practical. So I want to make sure that this is going to be working out for you. In week number 1, I'm also going to be talking about the anatomy. We talked about nerve damage and managing complications and things like that. You need to know the red zones. You need to know the sensitive anatomical structures so you don't go there, so you don't damage them. Very critical. All the nerve damages that I see come from lack of attention, lack of knowledge of the red zones, which are basically the sensitive anatomical structures. There are 6 in total. I'm going to review this in week number 1. The same week, I'm also going to be talking about what are the best implant flap designs. You'll notice that if you start to do aesthetic and functional crown lengthening, you will be better at implants. So I want to sharpen your knowledge in regards to implant flap design. So when it comes to do implant surgeries, you make better decisions and you don't waste tissue. Okay, so the anatomical red zones, anatomy, knowing the best implant flap design. Now, next week or week after, I'm going to be talking to you or teaching you when to recommend crown lengthening and how, meaning how do I talk to the patient? How do I deliver the treatment plan? How do I do a case presentation? And I want you to finally understand short teeth. I want you to finally understand that short teeth and delayed eruption and different altered eruption patterns are not something that is not solvable or not treatable. Okay, I want you to be able to talk to your patient with a gummy smile while you have the knowledge and the confidence and bonding with the patient, not just because you know everything, but because you're genuinely interested in helping them and making sure that you pick the right cases so you don't perform the wrong procedure on the right patient and vice versa. Okay, it's very important to understand the diagnosis and what procedure can solve that. I'm also going to be teaching you how to diagnose the restorative problems and avoid crown redos, avoid patients being aggravated. How annoying is it when you deliver a crown and it decays out 6 months later because the margins are too deep and the patient cannot maintain it, or you have patients that have actually induced periodontal disease because the margins are too deep. There's bleeding, there's bone loss. You're going to be learning all of that in week number 2 so we can avoid these types of problems. So we're going to talk about the theory, we're going to talk about the gummy smile, the indications for surgery, the restorative challenges, and show you the step-by-step. Now, some of us are not comfortable with the surgical kit and not comfortable with the administration and how to talk to the patient and how to streamline the procedure and how to work with your front desk and present the treatment plan and the cost estimates and the consent forms. In week number 3, we are preparing for surgery. So we're preparing not just to do a procedure, we're preparing to be successful. So I'm setting you up to be successful. So in order to be successful, you need to have the end in mind, the final goal in mind. So I'm finally going to show you how to determine the perfect gingival margin. So when you plan your gingivectomy, your teeth are not too long or too short. I'll show you a simple digital simulation without confusion, without overwhelm. You've seen some videos of mine on social media and YouTube. I'm going to up a notch, kick it up a notch, and provide you with the surgical checklist of how you can do it. What are the different steps so you don't skip steps and you have issues. Okay, make sure everything is ready in your practice and the exact protocols and systems that you have to have in place. I'll show you the road for success, the different step-by-step for functional and aesthetic crown lengthening until week number 4, which is like, okay, it's surgery time. And this is when I show you how to perform an aesthetic and functional crown lengthening step by step with many, many cases, show you the exact protocol of how you can improve the ferrule effect and the retention so you can avoid the deep gingival margin and the failures that come later on. I'm going to show you how to correct short teeth and correct the gingival asymmetry, and also talk about some of the complications that can happen. So you'll see all of my cases. You have many, many videos that you can watch at your own time, that you don't have to spend, time. Anytime you have a patient cancellation or you have some downtime, you can watch these videos and make progress inside this course. So you learn it step by step. Part of it, learning surgery, is not just doing crowning thinning. There's a lot of side procedures that you're going to learn, like removing torus and exostosis, dealing with your ortho patient that has hyperplasia. How to perform those gingivectomies is real critical. Okay, is real critical because if your ortho patients have this hyperplasia and problems, then you won't be able to proceed with ortho. So a lot of the dentists out there are doing ortho. You're going to be learning about how to handle your ortho patient with gingivectomy. Now, who doesn't have patients with the need for frenectomies? Frenectomies are simple. Frenectomy is a simple procedure. I'm going to be reviewing that as well. Gingival hyperplasia. So in summary, this course is a 4-week training on a private and a dedicated platform. And when you join a community like Rashad and myself and thousands of doctors all over the world that love to learn. Not just doing it because they hate dentistry, but they really love to learn and excel. And you'll be joining our private Facebook group called the Surgical Mastermind, where all the doctors that attended any of our training in the past are part of. It's our safe haven where we basically share our cases. And when you have a case, nobody's going to criticize you, nobody's going to judge you. Definitely, you'll get feedback and encouragement, and we have synergy. You'll get opinions from doctors from all over the world. You have my professional opinion on your cases, and that's the fast and easiest way to get back to you. I mean, I'm now getting so many emails on a daily basis. My inbox has thousands of emails that I didn't answer, and I apologize if you're one of them, but it's real overwhelming and it's really impossible to answer all these questions. The Surgical Mastermind was created so you can communicate with me directly on a daily basis. So you'll be joining that as well and learn from us. So you'll be getting also my checklist, my handouts, my instrument list, my consent forms, and you'll have a full year access to this program. When you're graduating, you're getting your graduation certificate. Okay, like Dr. Carl Wirtz here from Glendale. He is actually the first graft surgery that he did, the first periodontal surgery he did was under my mentorship. He's doing now amazing. He's doing now implants. Why? Not because he learned the technique, but because he learned the mindset of confidence and how to handle those types of situations. So the program itself is 4 weeks, and you'll be getting 20 CE credits, and they're all California credits, all approved. The cost for this program is $1,997. So if you had to get this level of mentorship and training and this number of CE credits and the daily interaction for a full year, we're looking at tens of thousands of dollars. We try to price it in a reasonable amount so doctors can afford it. I also offer a guarantee. So what does it mean? You can take this training, and if for whatever reason you're not blown away, you're not 100% satisfied with the training that you took, then simply send us an email and just let us know it did not work out for me. I want to return it. No questions asked. So we will refund you immediately the charge on your credit card. No questions asked, money back guarantee. It's a really strong guarantee. I wanted to really remove any element of risk when it comes to buying something that maybe you're not sure about. I mean, you know the need, you know that you need systems and protocols and this surgery is important, but you're not sure. Well, you can go through this training, get all the knowledge, get all the implementation protocols, put it to the test, utilize it, and if it didn't work out for you, there's really no loss. You can always give it back after 1 month. Now, for the doctors who are joining, I'll be giving the bonus number 1, which is the crown lengthening strategy training. It's an audio program that is 6 hours that you can listen to anywhere that you're at. It is a $795 value that you'll be getting as a bonus. And you can listen to it. And it's not enough to learn those techniques. You need to find ways to implement them. So every CD, and that's a physical CD that you'll be getting when you sign up for this program, every CD talks about different topics. Like the first CD talks about surgical principles and flaps and incision outlines and the instruments. It talks about the challenges and how you can implement crown lengthening in your practice so you can be more successful. So every CD has its own topic for 1 full hour, which you're also getting CE credits for, all the way to dealing with complications. So the protocols and everything else is included. So a lot of the dentists, when they listen to this program, feel like I talk to them. Now, we now have thousands of doctors all over the world that are part of the surgical master community. So many, and I honor you for, you know, being so supportive, and being supportive not of me and our brand, our company, but being supportive of yourself and your family. You're doing the right thing to elevate your personal value level, to do better, to excel, get to the next level, and be successful. That's really the whole chase is all about that. Now, if I can show you some shortcuts, shorten your learning curve, create some clarity, eliminate confusion and doubt, and really inspire you and motivate you to do this, then you're going to be surgery ready. So I'm giving you all sorts of tools, like the audio program, like transcripts. Some people like to listen. Some people like to read. Some people like to watch a video. I like it all. I like to learn from all the resources. And I know that something is going to stick and going to make a difference. So I'm also giving you the transcripts of the audio program. And here's Dr. Supa, whom I mentor for many years. He's in Melbourne, Australia. The audio program and the strategy training is reinforcing what you learned during the course. It's not just listen to some audio instead of music. Music is great. I love that. But music gives you one type of energy. An audio program that teaches you strategy gives you a type of energy that is self-fueling. You know, once you light a fire, once you ignite a rocket, in a good sense, okay, if you can't stop it anymore, and that's what I want for you. I want you to be unstoppable. So Dr. Supa, thanks for being such a loyal member of the Surgical Master community. So today you can join the crown lengthening surgery online and get the strategy training. You can join by going to joinsurgicalmaster.com, makes sense. And both of these programs are fully guaranteed, meaning you can join today, take the training, take those 4 weeks of training, listen to the 6 hours of the audio, go through the weekly videos, go through the exercises, start screening patients, implementing, get my mentorship, and if for whatever reason it didn't work out for you, then simply send us an email. Your money back is guaranteed. There's absolutely no risk involved with that. And if you do that, and I'm totally fine with that, please give me some feedback how we can improve. You can keep the physical product. It's like a token of appreciation on my end. I appreciate the feedback. I appreciate those thousands of doctors that already joined our trainings. And if for whatever reason this program did not meet your expectations, I'm cool with that, and I appreciate you and I honor you, and please keep the audio program, the strategy training, and I hope this is helpful to you. So what you need to do next is go to joinsurgicalmaster.com. Okay, I'll repeat that. Real simple. We should have it probably in the chat box, the link, so you can just click on it, joinsurgicalmaster.com. You'll end up on a page that repeats the offer and the price point. And you have also payments that you can make. And if you join today, I'm going to be giving you the protocols. Okay, so everything we shot today, edited for digestible learning in small, concise chunks of information. So when you go through those 21 protocols and you have your book companion, then you can learn better. You can share this with your staff. You can create your checklists out of there that are technically checklists. And basically, you go through this book, you go through this training, and it keeps adding value as you go through these procedures in your practice for years to come. So I'm going to be including that as well. That's a $997 value. We have some doctors that already took the crown lengthening. Only for those we can offer the program separately. But today, because of the holidays, we're offering the surgery ready for 2018 holiday bundle. We're offering all of this together because I want this to be working for you in the new year. Bonus number 3 that I'm going to be offering is the Beverly Hills 3-day implantology broadcast. These are clinical and practical lessons in implantology of how to set up your practice, what you need to do to create an implant inventory, how to negotiate with your rep, what are the basic surgical tools, instruments, guided surgery, what you need to know to be implant surgery ready in 2018. And again, this is a bonus you're getting when you join the crown lengthening program. It's a $500 value. It's divided into 3 modules, 3 days, where every day we go over very specific things that have to do with implant dentistry. We call this the implant gold rush. Okay, so I'm going to show you how to leverage the implant surgery in your practice and make it more successful. So sharing simple pearls and golden tips that you are not supposed to know. Nobody teaches these things. Nobody shows you how to negotiate with your rep and how many implants you need to have in your inventory. I'm going to talk about the economics and how much to charge for an implant and what's the reason for that, how to create your fee structure, how much do failures cause you, and what do you need to do to minimize failures, increase your profit margin. And in the 3rd module, in the 3rd day, I'm showing you step-by-step strategic integration of implants in your dental practice. So I'll be offering this. You'll be getting this as well when you join the crown lengthening program. I'm also be giving you the Nextlevel implant training, which is for super GPs like Dr. Ryman here, doctors that want to not do a drill and fill. They don't want to be like the run-of-the-mill doing simple root canals and some fillings. They really want to take it to the next level, like someone who wants to be successful. So you'll be getting the edited recordings of this training, again, into short, concise videos, so you can learn about the roadmap from simple cases to advanced cases. What are the milestones that you need to meet in order to be successful and do the bigger cases? Everybody wants to do big cases, me too. I'm going to show you what is the sweet point where your profit margin actually goes down per implant when you do bigger cases. So I'm going to be showing you the principles about that and help you also with the fee structure in your practice. So you'll be getting bonus number 4, the Nextlevel implant training for super GPs. And I'm also going to be giving you, when you join today as part of our Hollywood holiday, we're in Hollywood. I'm sorry, it's been 8 hours. It's been 8 hours. But we're going strong. Okay, we want 2018 to be strong for you. So we'll be offering you the Surgical Master attire, the scrubs, the surgical cap, the Surgical Master teacher t-shirt. Okay, it's been 8 hours, so we're good. And to get the whole bundle, you go to joinsurgicalmaster.com. You pick your payment plan, and you can do it in 2 payments or 1 payment, and join us and be successful and be surgery ready in 2018. Dr. Camila Buquer is now in Mexico. He sent me an email this morning. It breaks my heart I won't be able to attend the surgery and the broadcast, and I told him, take care of your kids, enjoy Mexico. Okay, but he's a great guy. He attended the accelerator program. It's another. Do we have an option to join that as well?
Once they join, they will have an option to upsell.
Okay.
To go together.
Okay, good. So once you join the crown lengthening program, if you're interested to take your skills to another level and go even more in depth and learn more, be more successful, you have an option, and you don't have to, but you have an option to join the Surgical Master Accelerator program, the Implant Accelerator that Dr. Camila Bouquet from Ottawa, Canada just joined. It's a limited attendance program. We only accept 24 doctors per course. And that's a course here in Beverly Hills that includes 12 months of mentorship. So same thing, go to joinsurgicalmaster.com, see what the bonuses are, look at the offer again, look at the surgery ready offer for 2018. Look at all the bonuses, and then there's a button to click where you can choose your payment plan and get started, and then you have an opportunity to join the Surgical Master Accelerator. So the offer today is really clear. I told you during the day that you'll be able to get the protocols and systems book and this training if you don't join the crown lengthening surgery. The crown lengthening surgery online, at the value of $19.97, the crown lengthening strategy training, the audio program at $7.95, the practical implantology lessons and implantology surgery for GPs, each one $500 in value. The course that we filmed today for the past 8 hours, and the companion book, the physical book, the protocols, plus the Surgical Master attire, joining the Surgical Master Mind Group on Facebook, the total value of this training is $4,934, about $5,000. Now, if you had to take these trainings separately, crown lengthening and implants, and strategy and protocols and treatment planning, and live mentorship, which is really the key of your support system. You have access to me all the time through our Surgical Mastermind group. If you go to the higher level of mentorship, you also get the Surgical Master app. It's called Mentor, where you can, from your phone, you can directly text me pictures and we can talk. But that's if you join the Surgical Master Accelerator. If you had to take all these courses separately, we're talking about tens of thousands of dollars with access to a real live mentor that is passionate about helping you reach the next level. Now, this is not a small amount, great value for what you're getting, but I would like to offer to you today for $1,497. So you can benefit from crown lengthening surgery online, from the strategy training, the different broadcasts, the strategies and protocols, plus the book and the Surgical Master attire. A lot of doctors around the world are very proud to wear the Surgical Master t-shirt and enjoying that. And now this whole bundle is offered for $1,497. You can go to joinsurgicalmaster.com, pick your payment plan, review the offer, review the bonuses that you're getting, send us an email, or you were still on the chat so you can ask questions. This program is fully guaranteed for 4 weeks, for 30 days, actually a little bit more. I wanted to remove all the elements of risk. So there's no risk, so you can join and not think, oh my God, what if it's not for me? No, you take the training, get the knowledge, get all the tools, the instruments, the protocols. We send you the book, we send you the CDs, the Surgical Master attire. And if you decided to refund because it wasn't for you, no hard feelings. I don't get insulted. We now have many doctors who joined our training online, different programs. And the return rate was negligible. Not because there was no option, just because doctors are getting more than what they pay for. So, but if you decided it's not for me, let us know and we refund you fully back. Plus, you can keep the physical product. So this is my full guarantee, no questions asked. It's the best guarantee ever. So like it or keep it, okay? If you like it, great, keep it. If you don't like it, still keep it. Keep the physical products. And the way to sign in is joinsurgicalmaster.com. Here's Dr. Chirag Patel. Thanks for the holiday gift. I appreciate that. I showed you how to do surgery. You performed beautifully. You did a root coverage procedure. I'm proud of you. You're one of the surgical masters here in Beverly Hills, competing with Dr. Rashad Ryman. But in our surgical master community, we support each other, and we appreciate and we celebrate each other's victories. And I appreciate everybody on this call today. This is the summary of this broadcast. This is really the conclusion of this broadcast today of 8 hours on December 26, 2017. We have 5 more days to the new year. You have 5 more days to decide how 2018 is going to be surgery-wise. Your 2018 is going to be amazing no matter what. You're going to be great. Your family, God willing, will be healthy, and you will be healthy. You'll be able to enjoy life, work, produce, enjoy dentistry, have fun, take care of your kids, your family, your wife, and your hobbies, and buy the car that you want. I also want you to be surgery happy and surgery ready in 2018. And this is why I put the effort to create this training, to put together all these bonuses and allow you to take the last step before the year ends. You see, the information alone is not enough. You know, seeing some videos, even reading this book by itself, there's a lot of information here, but it's not enough. You need support, guidance, and mentorship, and you need somebody to keep you on track. If you are just like most people, you tend to drift away. You tend to lose focus. You tend to not implement. If you have a mentor and a guide like myself, which I made it my life's mission to help dentists around the world to be successful in surgery and have the clarity that I have. I already have clarity, and I already enjoyed the benefits of going through, of performing these procedures in my practice. And I just shared with you 21 protocols of how to do things step by step. I have it. Now I want it for you. It would be a great gift for me when you join me. It's a gift for yourself. It's now at a very affordable price, totally guaranteed. And regardless whether you join or not, and that's really important message for you doctors all over the world watching this on social media, on our broadcast page. I hope this training today was helpful and beneficial and practical to you, that you picked up 1 or 2 things, or 10 or 20 or 21, and that you took some good notes and that you can now start implementing. That is great, whether you join or not. For the ones that join, welcome to the Surgical Master family. I'm excited to welcome you. Dr. Rashad and myself love having new doctors. We already have a hardcore, die-hard fans and participants in our community.
This is my protocol for your success, and I wish you a happy new year.
It's the culture and it's the people. I felt like home.
I met today people here from all over the world, from Saudi Arabia to Algeria to Canada to Russia.
I've gone to a lot of CE courses. You can see the gray hair, but I've never been to any kind of meeting like this.
They break it down to you, you just understand it. You know, you don't need to do anything. It's just so easy to understand.
I mean, where else are you going to find a guy from Lebanon and a guy from Israel collaborating at such a high level?
You finally go to a course where they promise you learn certain skills and they give you more. And the difference and the change in the mindset with what Ziv and Rashad are doing is really being honest, uplifting others, and no one else does that.
The way the materials were presented were a way that I can go back on Monday morning tomorrow and do any of the procedures. I feel very comfortable, and it's been actually one of the best experiences of my life.
There were situations that I would put an implant in, but looking at how Dr. Simon would do it, I was getting good results. He was getting great results. So it allowed me in that aspect to take it to the next level.
While listening to the lecture, there are times that, I want to take a break and go to the bathroom, but I didn't want to miss what they're going to say. That's how adamant I was to absorb everything that, they were saying.
There were just a lot of aspects of this course that provided clarity for me to things that I already do, but I feel like I'll do better when I go back.
I cannot wait to go back to Ottawa and to implement this technique because, my God, it's beautiful.
I was expecting a 10 on a scale of 1 to 10. He gave me a 50. The course super exceeded my expectations.
Dr. Ziv Simon is amazing. He is a great educator and excellent mentor.
I really enjoyed this course and interacting with Dr. Simon and also all the other surgical masters who enrolled. It's been a fantastic learning experience, and I fully recommend it to anyone out there, be it a beginner or someone who's experienced. I believe there's always something out there to learn.
Ziv comes from a place of abundance, and he's elevating the standard of care. I highly recommend his course.
I'm absolutely indebted to Dr. Ziv Simon for opening a whole new world of surgical periodontics to me. He is a phenomenal mentor. I just saw one of his YouTube videos. I got hooked to them and watched video after video.
The thing that I really like about Ziv's teaching philosophy is that he tries to teach you how to do these type of surgeries in a predictable and safe fashion.
Surgical Master is giving me a huge inspiration in dental surgeries, and it keeps pushing my limits all the time.
Hi Ziv, I just want to thank you for all the time and effort that you put into creating all your videos and PowerPoints and everything that you do for us general dentists. Every week I listen and I read to what you've produced, and every time I do that kind of work in my practice, it does help me immensely. And I always use your words of wisdom to make sure that I'm doing a good job.
Dr. Simon is an excellent teacher. He goes above and beyond by not just giving us an algorithm to follow. What he does is he goes in depth through the whole decision-making process that has to happen in order to treat these surgical cases properly, and in order to be prepared for these cases as well. I am just glad that I took the course, and I can't wait to implement everything that I've learned so far.